Oh, that's why I put it on the agenda.
Yeah.
Okay, it's 3:30, so we're going to go ahead and get started. Mr. Peterson, we don't have any action items from last meeting. The only thing that was submitted for the agenda was a contract for EMS. I understand Mark had some type of emergency, so Ms. Ciresi is going to be talking about the contract. Well, fill us in on it.
Yes, this was a contract services agreement with Public Consulting Group Emergency Services Agreement. It is about they would get a percentage of what they collect from what we would collect from this called ASPP. It's Kentucky Ambulance Supplemental Payment Program, which is different than the APAP, which was the ambulance payment program that's been around for a while. This one has to do with cost studies that are done once a year, and then you'll get an extra line of money if it is all approved. Mark did this last year. It didn't get approved. We have now found out that he's got about 2 weeks, and I'm going to work with him on the cost program and see if we can get approved for this year. We can end up using this company in the future, but right now it's not important that we sign this contract with them anyway. Jenny's still going to review it, but we would have a few months before we would need to sign this contract for this cost survey. It's a very intensive. It's called it's Kentucky Ambulance Supplemental Payment Program, and it was started about a year ago, March of 2025. They had a short period of time to send in cost information, and I'm not sure exactly what happened. This was a training. That's just a training program that I found online. But anyway, this company has been doing this for some of the other counties around and been able to get them anywhere from $80,000 to $100,000, depending upon the size of the county. And it is for a supplemental cost. You know, looking instead of what Medicare and Medicaid are paying, but this is really just Medicaid. They look at what your costs actually are and look to supplement that more for. So it's a lot of detail to go in, and actually it relates to all the Medicaid runs that you have. Oh, this company is Public Service. Yeah.
They presented at the last Lincoln Trail ad. There were several counties, I believe Washington, hold me on that, but they presented that they had success. They were able to bring them in, $100,000, I think, $200,000 extra, because this consulting company, I guess, has, first of all, they got time. That's their job. Whatever they bring in, they get a percentage. I think in the future should probably look at utilizing them, make sure they maximize benefits.
Basically, what happens is they still have to get all the information from us. So you're still compiling a whole lot of information for them, send it to them, to fill it out. But when Mark gets back tomorrow, first of all, we have to finish this grant that was approved. Application Tuesday, and then I'm going to work with him on that, trying to get copies of the last surveys, and we'll go from
just for
what kind of percentage they get?
that. It's 10%.
10%?
Yep. And it's only the federal share portion of reimbursement received by us
right
under the KYAS. For each reporting period, there's 3 reporting periods.
Okay.
Okay. So anyway, we're putting that on hold. We're still working on it, on the pieces that we need to get going, but it's a calendar year.
So for court, you all are still going to be working on trying to get some money from that program, but not utilizing a company.
Not right now, not right for 2026. Future, I think we should use this company.
But you all are
Probably
working on.
We're working on it,
You
but
and
it
Mark
doesn't
are.
have to go through court. This
Or
is a
maybe-
cost survey that you're filling out. And then the other thing I had, was this brick grant, just an update on it. Filed for it last Thursday. I got a couple comments back to edit some of the information. Wasn't much, like name, and we had questions on the budget. It's a lump sum contract. This brick grant on the 10 storm shelters that we're trying to get. So we've met the deadlines. Right now I have to upload the maps and get it under there.
That
Maybe.
deadline, updating information.
Yeah, we're updating it now, and so but we're all on schedule for it. And well, that's FEMA. I don't know if you wanted a FEMA update. Okay. That's emergency services. We're down to the last. I'm on our 4th program manager, and now he's off on another project. But we're up to date with sending them all the information we need. We're just waiting on them for final approval. They have obligated the last part of the roads, the Boone culvert. It's about $24,000 to us. That was as of 2 weeks ago. So we're supposed to be getting that money through Kentucky in time now. And then the rest of it is just them finally agreeing on all the donated services and some of the emergency management work right at the end. So we're waiting on them.
All right. So yeah,
That's all I have.
Hayes Mark's not here, but maybe you can ask him. I've been watching the claims as far as uniforms. How do we track uniforms as far as when we get a new employee at an EMS or anything and then they leave? Do we get those uniforms back or?
They try to. They usually do. They have a system over there that one of the supervisors over there keeps track of all the uniforms when they give them out, when they gave them out, like the annual allowances on them, and then whenever they bring them back in, like especially if they're damaged or anything, they take control of those and dispose of them because it happens. But yeah, they do bring them back in.
How often do they, or does someone have to get new uniforms? What's the life of them?
Well, I haven't asked them all that. I'm getting ready to get over there and kind of get in more detail about all of their procedures, but they do have a process for it. And at most a year, probably.
I think it is a year.
End of the year, the
Yearly,
life.
yes.
Yeah, you would know more about
Yeah.
it over there.
And I know
Yeah.
they do collect the shirts. I know they have some pants and stuff that they keep up with. Some of the new people they hire are issued those as well too if they fit them. So
the shirts have their names on them.
some of them do, some don't. Yeah, some of them don't. Some are just basic EMS shirts.
And my concern was just how are we controlling that, how accounting
Yes.
for it? Because I know there's a uniform allowance.
Yes, sir.
I know how that works sometimes with some folks. They got allowances. Go and get uniforms if they don't need them.
Sure.
I didn't know how that was being accounted for.
Yeah, I'd have to let Mark speak.
They
for us.
they watch them. They know when they've used them, and what they have been doing is using a Galls account, so they know what people have gone, when they got them, when was the last time, and it's an annual thing. So they are watching those. They're looking at using another service for it to account a little bit better for the all the uniforms. But I know there was a question about, well, they could just buy black pants anywhere. Well, they have tactical uniforms, and they have very specific for the job, almost a military like need for it. But I'm going to be working with them a little bit tighter on it. But they do have an accountable system.
Is there a concern? Specific concern?
I'm just looking at the expenses on the uniforms and galls and stuff and just seeing how we control that. I'm just wondering Yeah.
We've got a system to control it. But there was-
No, just looking at their
Some,
expenses.
some of it, it'll go up with turnover. So, they'll get them back, but whether they're also usable when you get them back, between what happens, on the job. Stains and tears and things like that. So the turnover has an impact on cost.
I was kind of curious about that too, whether or not they recycle them through and reissue.
They
If
do
they're-
as
if-
they can, yeah.
If they're not used for a long period of time,
If-
there's a new hire and maybe it's a quick turnover, whatever. Seems like they would be able to recycle.
They do
They do try to.
when they can.
Well, the only agenda items that we had was the contract. Anything, anybody else have anything?
So it was kind of brought up yesterday in the final part of the public works meeting. Fred had mentioned the grant opportunity. And this was from Neil Vickery out of the Guthrie's office.
Guthrie's.
And one thing that I know, Joey, you had been working on was potential housing for FEMA, et cetera, and then a response team.
Yeah.
That grant potentially could be a perfect asset for that.
Yeah.
So just wanted to kind of bring it up, and maybe you can let everybody else know kind of what you're looking towards, looking at.
Can I actually jump in there also? Because he came over there about that grant because first came to and said they thought that we could try to said that he talked with was Clement and that where that we had some equipment that was becoming end of life and that this grant possibly could cover that. And so then I got him with Mark. And so him and Mark got together, and and then Mark said, "Well, I said, yeah." I said they talked about it, and the guy told him he couldn't, that it wouldn't cover. So I didn't know if y'all covered that part of it. But
We did, just to shorten it up, and gave you a copy of the grant application.
okay,
I read through some of this, and yes, just to clarify, I'm sorry that we were late to the meeting. Also, we were working on this in person call. So what we're looking for is a point of distribution, place to house, in a regional point of distribution, is what kind of we were shooting for. That would, I think, open us more to federal money if we had more counties that could utilize this. And Hardin County is sitting in the hub. We're within 30 minutes of multiple different counties that we can help respond out to and have supplies here. That's what we were originally, the Kitty Hawk Drive, Hayden School Road area. There's a warehouse over there that was being built. Well, it is built, turnkey now, ready to go. That's what we originally started when I brought it to you all. So again, I've looked through this, and Ms. Clem, I don't know if this is the right grant or not. This is actually the AFG grant for fire departments. I don't know if this is
That's not the same.
I don't think it's the same one. So, but I would like to speak to Mr. Vickery and see, because Fred and I.
Mark has the other one.
Okay. Mark Abster has that one. Okay.
Right.
Okay. And like I said, I like to look through and get but I know we have a limited amount of time to apply for it. I think it's 26th of June. So again, these grants, that's kind of what I was explaining to you. They just come quick, but I would like to look into it and hopefully apply for it if we can get that opportunity. Because I think
It's got a lot of information. So I think that we'll be able to do it. Just need to verify the grant.
James Victory, I put a call into him too. If I can see the documentation, I'll help them get it together.
Fred's got both of them. I bet he could get you.
Yeah, when I caught you in the hall.
Yeah.
Mark was there too, and I gave him the one that goes both ways for
Yes,
you and him.
Yes.
That is just a different, that's a FEMA for fire departments.
That's AFG.
Yes.
Yes, sir. Yes, sir. But
That we got the same deadline.
yes,
But it's not anything significant, I don't think.
it's just driven toward fire prevention and fire safety programs. So.
Right, I saw that. It's on the FEMA Go site that I was on with Greg. So, look into it, but I didn't see.
Yeah, let's double check.
Anything else, Aaron? Anybody have anything else to discuss?
Good.
All right, hearing none, we will adjourn at 3:45.